right. I think we'll get going. We'll start off with a little intro, and if other people file in then, hopefully they'll be in by the time we really get started. Welcome everybody who's here. Thanks for coming to IPHA's Third Thursday Lunch and Learn web series organized by our Education Committee. I'd like to dedicate this time every month to sharing our successes, maybe some of the detours that it takes to get there, because those can help us grow too. And just so you know, this is the last one of this season, of the 2021 season. We'll take just a couple months off, July and August, and then we'll be back with more Lunch and Learn starting in September. We're still planning for the next season. We have scheduled through most of winter, I think, and then we have some openings starting in February through the beginning of next summer, through the spring. So if any of you have an interest, or if you know a topic or somebody else that might have a topic that you would like to present, let us know. Email me, email Lena, somebody else, either way, and we can work on getting it scheduled. So the point here is to connect, learn, and strengthen the voice for public health in Iowa, which of course is part of the mission of IPHA. And if you're a member, we thank you for that. If you're not yet a member, we invite you to join us and help carry out our mission. You can do that on our website at iowapha.org. Today we're talking to Rachel Schramm and Kelly Wells Sittig of the Iowa Cancer Consortium, and they'll share what the consortium has been up to and so, what some of their plans are. Before we get started, just a couple housekeeping items. Your microphone should be muted and video off during the presentation, just to help us keep enough bandwidth for the presenters. And you can put your questions in the chat or Q&A function. I don't know if we have the Q&A function on, but you can put it in the chat. And then there should be some time afterwards where you can unmute, turn your camera on, and we can talk. You can ask questions, whatever you like. The session is being recorded. It'll be posted to IPHA's YouTube channel afterwards. But now I'll turn it over to Rachel and Kelly so they can introduce themselves and tell you about the Cancer Consortium.
Awesome. Thanks so much, Brett. So good afternoon, everybody. My name is Rachel Schramm. I am an outreach coordinator at the Iowa Cancer Consortium. And again, we're just really excited to present and have you learn a little bit about what we do at the Iowa Cancer Consortium. So the first thing that we'd love to do is maybe just do a couple of introductions. I know because we have a smaller group. So maybe we can go ahead and do our name, your organization that you're from, and then maybe just like your location in the state or your connection to cancer, like what really made you come today. So I don't know, Emma, could I ever start with you?
Yeah, for sure. Hi, everybody. My name is Emma. I'm with IPHA, and I'm from Urbandale, Iowa. And my grandma actually had breast cancer. So, yeah.
All right. Thanks for being here. Heather, do you want to go next? Maybe. I know people are eating their lunch too. Elizabeth, could I go to you?
Sure. I'm getting my kiddos lunch, but my name is Elizabeth. Hello, my name is Elizabeth Faber, and I'm the facilitator of Iowa Immunizes, which is a statewide immunization coalition sponsored by the Iowa Public Health Association. And obviously, I have a professional stake in cancer, especially with the cancer prevention vaccines that we have and promoting those. And also my baby nephew, Eli, passed from brain cancer at 18 months old. So cancer has certainly touched our family greatly.
Yeah, thanks for being here. Let's see, Michaela, do you want to go?
Yeah, hi, I'm Michaela Carson. I'm with Iowa Total Care in Des Moines, and I have several connections to cancer with grandparents and my father. So.
Thanks for being here.
Thanks.
Lisa, do you want to go next?
Yes, hi. My name is Lisa James. I work at the University of Iowa Student Health Service. And I just listen in on these periodically, and I have a history of working in cancer at the Cancer Center. Did we work together once?
I think on some HPV thing like years ago. So
students, yeah. So anyway, that's why I wanted to listen in today.
Awesome. Well, thanks for being here. Jane, do you want to introduce yourself?
Hi, I'm Jane D'Antine. I'm an account executive with Merck Vaccines. I have a professional interest in cancer. I support the ecosystem in Iowa. I actually live in Denver. And I have a very long personal history of cancer in my family. Lost my dad to cancer. I've had multiple skin cancers taken out. I lost a sister to leukemia. So it's very near and dear to my heart, but definitely a professional interest as well, and always willing to connect with people across the ecosystem in Iowa. Thank you.
Awesome. Thank you for being here. Let's see, Cindy. Okay, maybe we'll go. Liz, are you there?
I am here. This is Liz Orton, and I am also an outreach coordinator at the Iowa Cancer Consortium. And I just started at the end of March, so I'm sure that I will learn something today too. So happy to be here.
Thanks, Liz. And Greg, do you want to go next?
Sure. I'm Greg Woods. I'm with the Iowa Department of Public Health in the Chronic Disease Prevention and Management Bureau. And I've had sort of a handful of friends and family affected by cancer over time.
Thanks for being here, Greg. We go back a long time with the Chronic Disease Bureau. So, all right, Linda, do you want to introduce yourself?
Hi, I'm Linda Gorko. I'm with Iowa Food Bank Association. I haven't seen you in a while, Rachel.
Yeah.
Interested in all things health and food, and everything we eat impacts our body, and also very interested in cancer, and all of us are touched in some way with cancer, unfortunately.
Yeah. Well, thank you for being here. It's good to hear your voice.
Nice to see you.
All right, Amanda. Hey.
Hi, I'm Amanda Seiler, and I work with Virginia Gay Hospital and Benton County Public Health. So being a nurse, it's there. And I also have had personal family and friends that have been affected by it. So
yeah, thank you for being here, Amanda. All right, and then I know we had a couple people eating lunch and on the phone, so if you would want to chime in now, you can. Otherwise, maybe introduce yourself in the chat when you have time. So yeah, what we're going to do today is really just talk about what the Iowa Cancer Consortium is, why we exist, and really how we have the capacity to work with partners around cancer control issues statewide. We hope that you'll join us too, either on our email list or as a member. We love to meet new people and obviously know that everyone is touched by cancer somehow. So we'll talk about that a little bit. And then, yeah, we would love to, keep this open as well. So if you want to use the chat or pop in, we want to hear from you about how cancer has touched you or your community. So with that, I wanted to turn it over to our executive director, Kelly Sittig, to just talk a little bit about kind of the genesis of our organization and what we're all about. So Kelly.
Hi, everybody. My name is Kelly Sittig. I have the pleasure of serving as the executive director at the Iowa Cancer Consortium, and it has been a total treat to sit back and just meet all of you virtually. I hope you'll continue to connect with us through the chat box, and maybe Rachel could drop our email addresses quick in the chat, and I'm sure we'll do that again later too. Would love to connect with you down the road too. And I think that's actually a really perfect segue into talking about what the Cancer Consortium is all about, because connection is really at the heart of what we do. So we all know, and it's clear, like we all have personal connections to cancer. It's very, very rare to find somebody who doesn't have a personal connection to cancer. For me, cancer kept me from knowing my grandmothers. And there are two women who are like these legends in my family who I would have just loved to have had in my life. Because of cancer, I don't. So we all know that cancer touches everybody here in Iowa and honestly throughout the country and the world. So we're connected that way. We also know that it's a really costly disease, both in terms of dollars and in terms of lives lost and quality of life lost. And when you have something that complex and costly, it's really hard to address alone. And so that's where the Iowa Cancer Consortium comes in. We help Iowans who are working in cancer control or advocating for cancer and related topics in some way connect, find each other, work better and bigger together through those connections, and help them find funding, build skills, any sort of capacity building that we can help with, learning, education, all with our vision of, all towards our vision of an Iowa where cancer is not a burden, which we know is a big, an aspiration as a vision should be, but our way of working towards that aspiration is really all about connection and collaboration. We have, I'll mention one more thing, Rach, if that's okay. To frame our organization too, every state has some sort of cancer control partnership. And when we talk about cancer control, we talk about, you might hear folks refer to the cancer control spectrum. And what that means is anything from risk assessment and prevention all the way through quality of life. So prevention, screening, early treatment, end of life, quality of life, survivorship, anything that's encompassed within that is cancer control. And every state, many tribal entities and territories have some sort of cancer partnership. So you may find organizations in other states, tribes, or territories that look similar to the consortium, but I happen to think that ours here in Iowa is especially robust and passionate, and it's thanks to the partners that we have as part of this network.
Awesome. So I'm going to just go through a couple of stats that we have from our State Health Registry of Iowa. And Kelly, maybe if you wouldn't mind dropping in the link to the Cancer and Iowa report, that would be great. So just a little kind of zooming out and talking about cancer as a disease in Iowa. So it's estimated that about 2 in 5 Iowans will be diagnosed with cancer at some point in their lifetimes. Kind of a neat public health fact I think is pretty cool is that because of the critical need for data, cancer is actually considered a reportable condition in all 50 states. And in Iowa, that data is collected by the State Health Registry of Iowa, also known as the Iowa Cancer Registry. So they have actually been collecting cancer data in the state since 1973, which is really amazing because not a lot of other states do that. And they're also funded by the Surveillance, Epi, and End Results Survey, or they're a SEER registry, which is amazing and is one of the 21 US registries that are providing data. So what I also think is really cool is for like national studies about cancer and cancer rates, Iowa is used oftentimes. Our data is as points in there just related to like rural cancer outcomes. So I think we should feel really lucky that we have a great team over there that's always pulling the data. So one of the things that Kelly put in the chat is the Cancer in Iowa report. So every year that team puts out like this adorable little booklet that includes all sorts of cancer information and projections for the upcoming year. And then they also kind of do like a deep dive in the form of like written text and charts, either related to a specific disease or topic in cancer control. So in the past, they've done deep dives into melanoma, colorectal cancer, head and neck cancers, and actually just this spring, their 2021 report focused on health disparities. So if you haven't seen that before, I would definitely encourage you to check out that report. It's something that we look forward to every year, just because it's really great information to see what's happening in the state. So, but from their projections, they estimate that there will be almost 19,000 new invasive cancers diagnosed among Iowa residents just this year. The other really neat part about them is they're able to track the vital stats of over 99% of cancer survivors since 1973, which is just so crazy. So they're actually able to estimate that we have over 150,000 cancer survivors living in the state of Iowa, which is just amazing. And is also a group, you know, when you think about other chronic conditions and cancer screening and COVID vaccines, that we really need to be thinking about as well. The other things that I wanted to point out from this report is that heart disease and cancer are the leading causes of death in Iowa and across the United States. And I believe it was just this week that the amount of COVID deaths have surpassed that of what is average for cancer deaths on any given year. So I'm really interested, our team's really interested just to see kind of like what the stats are going to look like as we move forward to, see, we know that the death toll of COVID is bad, but we weren't sure that it would ever get that bad. So that will be really interesting. The registry estimates that this year, an estimated 6,400 Iowans will die from cancer. So that's something that we always want to make sure that we're watching and definitely paying more attention to those cancers that are diagnosed at a later stage, because we know from a public health lens that that's the way that we are able to hopefully decrease deaths that way. So like I said, equity is crucial to all the work that we do, and we're very excited to see the report this year in terms of like, it was one of the first years that just racism and systemic inequality was called out among cancer data. So they really hit home some of these points and were able to kind of slice and dice the data so that we can really see like where there are burdens and really what we need to do. So the Black population in Iowa has the highest mortality rate in almost every major single cause of death in Iowa, but that includes cancer. Some of the largest differences in that mortality between the populations are specifically related to prostate, lung, and liver cancers. So we know that that's an area that we really need to hone in on and provide resources for. And the Black population also has a higher colorectal and breast cancer mortality rate when compared to other racial and ethnic groups. However, we are heartened by the fact that the cancer mortality rates are declining for each racial and ethnic group in Iowa, and that difference is narrowing between the populations, between Black and white populations, but we definitely have room to improve. So Kelly and I will talk about that a little bit later, but that's definitely front and center in the work that we're doing with our coalitions and yeah, what we're bringing in presenters about and extra resources and technical assistance for. So I just kind of threw in a couple pictures here. So these are some of our members. Christine Carpenter from Waterloo has the flowers, and she actually won one of our partnership awards at our last in-person meeting. So gosh, Kelly, when was that? 2019, right? Feels like forever ago. All right, Kelly, do you want to talk a little bit just about our membership, and then we'll kind of go through just who's on our board and our staff?
Yeah, you bet, thanks. So we have over 450 official members of the consortium, and what that means is people and organizations who have chosen to be officially aligned with our cancer control network here in the state. So we have individual members, so people who choose to join for either $0 or $20 per year. We offer scholarships with no questions asked. It's just the click of a button for the person applying. We never want funds to be a barrier for joining. And then we also have organizational memberships, both a smaller organizational membership and then our standard organizational membership. And that's what you're seeing here is all of the organizations that currently align with our network. And then beyond these folks, we have a bigger network. So our membership is really our primary network and where we're most focused, and the folks that we're really working to support. And but beyond that, we do have a reach that is really more like 2,500 folks who've expressed interest in cancer control within our state. Members are all across the state. They are in organizations ranging from nonprofits to large health systems, to advocacy groups, and many more. You can take a quick, and these are all on our website if you're interested in seeing who's a member. But we have quite a range and are always trying to make sure that we are doing our best to represent Iowa's diverse populations. Tell you a little bit about our board of directors. So I know that coming up, we'll talk a little bit about our organizational structure, which will either put you to sleep, or if you're like me, will get you super interested. But we are a nonprofit organization, and so we do have a standard board of directors made up of a really cool group of people. So our president and vice president are 2 medical directors at 2 of the larger cancer centers here in Iowa. We have folks on our board, I'm sure you will recognize their names, but folks who represent research, local public health, advocacy organizations. We have somebody who identifies as a community health worker. We have, you may know Rudy Papaki, who's the health director at Meskwaki. We have cancer survivors. We have folks who are experts in grant making, because that's part of what we do is provide grants. So we have been super lucky to have such strong leadership, and these folks are elected by our membership. That's part of how our bylaws work. And actually we have an election happening right now. So if you're a member and haven't voted, make sure to do that by the end of the day tomorrow. And then we have an awesome staff as well. And so you've met me, you've met Rachel. We also have Kelly Rollins, who's our administrative and finance coordinator, and make sure that we keep our ship running. You've met Liz. And then we also have a communications contractor, Kelly Hindershot, who you may know as well. She used to live here in Iowa, worked at Gilda's Club in Quad Cities, which is a cancer survivorship and support organization. She's been helping us with some of the communications that you've probably received from us.
So this is another photo of something that of a project that we've worked on before, and actually one that's in process right now. So our members really do like to work together, and we somehow years ago figured out a way to get a community project going. So we know that in the summer, a lot of people are outside playing in the sun, and we want them to have access to shade and sunscreen to make sure that we're protecting them from ever developing skin cancer. And it's also considered an evidence-based intervention to provide that sunscreen at places where people recreate. So at pools, parks, zoos, all the things. So one of the things we said is why don't we do, we have funds that we need to spend for outreach. Why don't we do kind of a group buy of gallons of sunscreen that have the giant pump on them, and we'll have our members from all across the state apply and say where they're going to put sunscreen. So I can't tell you how long this project has been going on, but I feel like it's probably been close to a decade. But it really all started with minor league baseball parks. So that's actually where we kind of said, hey, we're doing this project. We want your, fans to be safe. Can we provide this to you? So it started with the Iowa Cubs, and then it went to the Burlington Bees, the Cedar Rapids Colonels, the Storm, the River Bandits. It went all over the state and just kind of stuck. And one of the neat things that we love is, besides the fact that it's an evidence-based intervention, it's actually become something that minor league baseball fans in Iowa come to expect, that these big giant jugs of sunscreen are going to be there in case they forget their sunscreen. So that's really cool. You will see our sunscreen gallons on the Ragbri route every year. So they're going to be, we always have some on the Beekman's ice cream trailer, food truck. I don't know what it's called. They will always be on there. And then we have participating cancer centers, hospitals, public health departments that'll be out and about when they're exhibiting for Ragbri. In addition, this summer, you're going to find our sunscreen out at other areas. So this little boy this was taken a couple years ago, but it was at Old McDonald's Farm in Cedar Rapids. That's where you'll find that one. And I'm trying to think of what other cool places. There's going to be a bunch of pools this year, which is really neat, and some parks. So just an example of a project that we do, again, to contain costs, but to really make an impact throughout the state as far as cancer prevention. Kelly, do you want to explain this like amazingly awesome slide?
Yeah. Thanks for saying it that way, Rach.
I like it.
Yeah. So this is like getting into the super organizational weeds, but I like it because it really shows like not only do we exist to help people build partnerships, but it shows that even that is possible because of partnerships. So what you're seeing here is what I call our funding flow slide, but it really is about our organizational structure. And I think of us as kind of a triangle structure with our nonprofit there in the middle of the 501c3. And then we have two other legs to this triangle. One is the Iowa Department of Public Health, who provides our funding for our major programmatic areas. And then the other is the University of Iowa Holden Comprehensive Cancer Center in Iowa City. So the reason that these two partnerships are so crucial to our organization is because IDPH, as I've already mentioned, they take a mix of CDC funds, and we are so lucky here in Iowa to have state appropriated dollars for comprehensive cancer control. And so they take those two funding sources and provide a competitive 5-year grant opportunity to manage a coalition to support cancer control, to revise and implement the Iowa Cancer Plan. And so I'm glad to say we just went through that renewal process and have been renewed for the next 5 years. So we take that money into our 501c3, and then we partner with the University of Iowa Holden Comprehensive Cancer Center to basically for staffing services. And what that allows us to do is, if those of you who may be from a nonprofit organization will recognize what a burden that having to do things like payroll and manage organizational taxes can be. So what this lets us do is staff our nonprofit with university employees and be housed at the university. So we are able to provide university benefits to our staff. The university very graciously donates us space for our offices. And so I really think you can see that it really does take these two extra legs and to make our organization stand. And it's almost like a multi-level collaboration is needed in order to make all types of collaboration necessary here in our state.
And I was going to say, and it works, you know, because we've been around for well over a decade. So that's really cool to see too. All right, and there's some partners at the summit wrapping up their exhibits. All right, Kelly, do you want to lead us through just kind of the org chart?
Yeah, you bet. So we've already talked about our board of directors and our staff who provide support at every level of our organization. We've talked a little bit about members. What we haven't talked about are work groups and committees. So I mentioned that our board of directors is elected by our right now more than 450 members, individual and organizational. But the other thing that members really can do actively through the consortium is participate in statewide work groups and committees. And the ones you see listed here are some that we have a little bit more active right now. So work groups and committees come and go as they're needed. Some of the committees are a little bit more standing, but we try to be responsive to the topical interests of our members in terms of getting to connecting with other people We try to be responsive to the cancer control and political and economic environment in terms of what work groups that we have. We try to make sure that our work groups have member leadership, and so that's kind of an indicator that there's a group ready to do work. And right now, these that you see here, so breast, colorectal, health equity, HPV, radon, research and clinical trials, tobacco, and quality of life are some of the work groups that we have actively gathering. And these really, they do a spectrum, like they all kind of fall on this spectrum of collaboration, I'll call it. And on one end, we have groups who really just want to connect with each other. So they want to meet every quarter, every 6 months. They want to keep in touch with the other people who are working in health equity, for example, across the state. The group itself is not necessarily doing a project together, but they still want to stay connected. And I'm going to steal this phrase from Rachel, who said it, and I think it's brilliant. It's kind of like priming that partnership pump. So it's keeping people connected, keeping their connections warm, so that when there's opportunity to move, people are prepared. But there's also a benefit. Rachel mentioned that we know people want to network, but they don't want to know they're networking. And so work groups are a wonderful way to do that, because it's a reason to get together and a way to keep people connected. And I just realized rural isn't on here, and it should be. That's one of our newer work groups, and that one falls kind of on the other end of the spectrum, where people are gathered, they have specific work that they want to do, maybe some more structured plans, and they're ready to work together to start moving a more systematic needle. And that we have work groups that fall kind of all over that spectrum that I just shared with you. So if you have interest in any of those or want to know more, let us know in the chat or email us later, and we could sure talk about that. And then our committees, I'll start with policy, because I think we need to change the policy committee to a work group. It really functions like a work group. So our policy committee / work group meets during the Iowa legislative session as a state-funded organization and housed at a state institution, the University of Iowa. We don't do any lobbying, but what we can do is advocacy, so education, and we can help amplify messages of our partners who do lobbying and advocacy. So if we have a partner who is promoting a evidence-based or has an call to action about an evidence-based piece of legislation, we can share that with our membership without adding our own "you should be for or against this," just like, hey, look at this action alert from so-and-so. And so that's a way that we can still amplify what our partners are doing and help them get their message out there. Again, that group just meets during the legislative session. So they're on a little bit of a break right now. And then we have some more standing, like organizational type committees, like communications, which really helps us do some of our proofing for communications pieces and provides input that way. Data and evaluation, which is available when we have those types of needs and questions. And then finance and nominating, which are obviously really focused on our structural organization.
Oh, and here's another picture woven in. So these are board members. On the left is Georgia Hodge, and on the right is Dr. George Wiener, and in the middle is one of our award winners, Paulette. So she's one of the health ministry leaders at Mount Zion Missionary Baptist Church in Cedar Rapids. So she's actually led some like healthy cooking demonstrations, and instead of having the regular donuts on Sundays, she's actually encouraged her church to adopt a policy that they will always have fresh fruit available and cut up at their church. So again, just an example of like a small change, but also a policy change within that organization. You've heard us reference it before, but one of the documents that really ties our membership together is called the Iowa Cancer Plan. So hopefully that looks familiar to some of you, but It's actually a document, a pretty thick one, that is created by our members and partners, and it really serves as kind of that high-level overview of cancer control issues in Iowa, both where there may be problems and where there's solutions and good work happening. So again, like Kelly mentioned, it's kind of like, I don't know, it's part of the consortium, but definitely like aligns in terms of like it focuses on cancer control. So cancer prevention, early detection and screening, treatment, quality of life, and health equity. So what our hope is that folks are, you know, Iowans or organizations are able to open this document to a particular area that they're interested in. They're kind of able to gauge like what is happening in this area, and then actually has some like action items with objectives and action steps for projects that could be implemented to bolster that area of the plan. The span of this document goes until the end of 2022. So we are going to be looking to update this plan. We don't anticipate a whole lot of changes. I think there's some specifically related to like vaccines, I think, right, Kelly, like Hep B and C, but we're hoping, we feel like we have a really good structure in the plan, so we're hoping that we can kind of just go through and shore up like what's working and then make some edits as necessary, but we feel like we have a really good blueprint. So, but one way that we really make sure that our members are aware and implementing this plan is we take some of our state dollars that we get from the Iowa Department of Public Health, and we annually offer a community grants process to our members and partners. So, and the neat thing is all of that money has to go to projects that specifically state like where they fall in the Iowa Cancer Plan. So are they working on HPV vaccinations? Are they working on promoting like diverse clinical trials in rural areas? Are they working on a palliative care or art project that would support cancer patients' quality of life? In our applications, we specifically have a section that says like, how are you related to this area? So I guess I don't know the average every year, but we're able to spend over $100,000, like award that out to community partners every year. And it's just so neat to see kind of how projects grow and spiral off into other projects after that. So the other thing I'll mention is, so every grant application that's submitted, you can apply for up to $25,000 per year for a project. So we've had organizations that apply for, you know, I need $1,000 for my church thing, or I need something bigger and more robust to take me through a multi-year project. So they usually come out every March, I think it is, but definitely in the spring. That's when we host that IFP process. So I just kind of wanted to share just some of the benefits that I think our members have as being part of our network. So monthly, we put out an issue of our Cancer Connection newsletter, and really that includes cancer stories, again, from across the spectrum, but both like nationally and in the state. We share member stories from our blog posts. We're able to share like upcoming resources, trainings, and conferences. But again, that's the way that we kind of keep our members up to date about what's happening, both at the local level and the national level for cancer control. One of the things that our members really like is every month, we put out coordinated message sets, which contain kind of canned Facebook and Twitter messages for whatever awareness month or hot topic is going on. So for example, our May messages focus a lot on sun safety prevention, and it's a way that we can get trustworthy information out into the hands of our partners, and again, really help organizations that might be bootstrapped for communications time, that they kind of have like a plug and play document that they're able to fill their social media calendar with. And we love the fact that it's related to cancer control. So, but we do messages like in January for radon, breast cancer in October. And we periodically release some kind of like off month sets. So we just did one on COVID-19 vaccines and cancer and kind of the intersection of those. So We think that that's a great benefit and a time saver for our members. Like Kelly mentioned, you can participate in work group and committees of your choice and based on your own interests. So again, you'll get the invites to attend the meetings. If you don't attend them, you'll get minutes. And if you do attend them, you're going to come away with the chance to discuss these topics with members that are like you and hopefully come away with some new friends and partners. Annually, we host 2 usually in-person meetings, our spring meeting and Iowa Cancer Summit. So again, just a great time to hear about timely topics in cancer control and from both national and local partners. We do the best we can to offer webinars and trainings to our partners. Just this past spring, 2 months ago, we offered a training from the Racial Equity Institute that was all about it's called the groundwater training, and it's just the idea of like we really do need to look at racism in our practices and social justice in public health. So that was like a half-day training, I think, that was free to our members. So it's a great benefit for them. And as members and partners, you will always receive support from our staff. So if you need anything, you have our email or you can call us. You will always have connections to other members across the state. We actually use the same membership software as the Iowa Public Health Association. So you're able to kind of use that searchable tool to find contact information or use keywords to find someone who's interested in the same things that you are. And truly, you are part of our team when you're on the consortium. We like to think that we are just kind of like the pushers and the pullers behind the scene, but really it's our members that we listen to and our leaders that help steer the ship so that we're able to do things that make sense and make us more efficient in terms of cancer control. So Kelly, I just put in here the couple slides just about our strategic plan. So I have this overview one and then 3 kind of more like in the weeds. So I don't know if you want to kind of forecast out what we're up to.
Sure. So we just went through a strategic planning process. And so this is different than the Iowa Cancer Plan that Rachel told you about. So the cancer plan is really meant as a tool for the entire state. Here's what Iowa and people in Iowa need to do to reduce the burden of cancer. This is like, what is the consortium as an organization? Where should we be steering to over the next 4 years? And so we did this, we worked with a consultant and who helped us poll our membership, worked with the board, with the staff, and there were some pretty clear strategies and priorities that arose from those conversations. And that's kind of what you're looking at here. So over the next 3 years, so this plan is for 2021 through 2024-ish, it's flexible, but our members and leaders and staff want us to focus on strategies, focus more on strategies that advance equity and cancer control. So, and make sure that populations across Iowa are receiving equitable cancer services and prevention. So big equity focus throughout this plan and our work. They also want to see us increase our focus on policy systems and environmental change, which makes a ton of sense because we know that's where we're actually going to be able to make big change. And along with that, folks are really interested in learning how to advocate themselves. So we will probably be doing some capacity building around that. And speaking of capacity building, so our last 3 strategies here are really about capacity. The first is about helping our members increase their capacity within their own cancer control work. Strategy number 3 is about the capacity of our network as a whole. So we've mentioned we have 450 plus members. Well, there is strength within that network, and that is a different entity than an individual working in cancer control. And so our strategic plan here will help us increase the capacity that wonderful network. And then the fourth strategy is about increasing the capacity of our own organization. So if you flash back to that really wild funding flow slide, like how do we increase our ability to have an impact as an organization? And so these next few slides, I think, probably show you a little bit more detail about what the tactics are that I think will clarify too. So for that strategy one, increasing our focus on these two different things, so equity and policy systems and environmental change and advocacy, for us will include things like incorporating ideas of equity and equitable efforts into what we're already doing. So a lot of integration within our programs. And the same for policy systems, environmental change and advocacy. So for example, if we're going to integrate these two priorities, we might look at our summit, which is our conference that Rachel told you about. Well, we're going to start asking, how can we integrate equity and PSE and advocacy more into our summit? And we're going to be asking that about all of our usual suspects worth of work. So we also want to amplify the voices of traditionally marginalized and or underrepresented Iowans in cancer control. It talks about increasing our staff capacity to help encourage our network members to grow in these ways. It talks about tools, and then it talks very specifically about our work groups that address these two issues, so health equity and policy. Go to the next slide, Rach. So talking about system, member capacity, so this should be of interest to anybody who is a member of the consortium or is interested in that. So, and this is where networking, or as we call it, sneak attack networking, starts to show up. So first of all, we want to meet people where they are. So when you have a network as vast as we do, and you have work groups that are on this spectrum, well, individuals are also on all sorts of spectrums in terms of their knowledge, their interests in learning and collaborating, their needs. So we want to meet people wherever they are along those different spectrums. We also want to provide tools. So wherever anyone is, we want to know what tools they need to move a little bit farther along this, our strategic plan are called an adoption curve. So we want to just get them a little bit farther along, and we want to have tools ready to help them do that. We also want to do, again, what we call that sneak attack networking, which is just like we are thinking about how to integrate equity and policy systems and environmental change into what we already do. We're going to be thinking about how to sneakily introduce networking that is not actually, we don't call it networking, into everything that we do, because our members have told us I want to know more people who are doing cancer control. I want to know who I can call more. I want more people in my own personal network. I don't want to network, so we're gonna figure out a way to give them everything. And then talking about aligning our cancer plan implementation grant funding to support people, again, meet them where they are and provide funding in a way that's more appropriate to wherever they are on that adoption curve. Collective capacity. So again, this is our network. So all of us together, what do we need to do to strengthen our collective capacity? You see a lot of networking here as well. Also see featuring members and ideas more prominently in our communication. So that might include a lot of social media. We have a really wonderful blog that Rachel started, which has been a great storytelling and informational tool for us. So pulling members into those, more annual campaigns, communications campaigns, about our network and the strength of the network, and helping people to use that network to their best interest. And then And then finally, the last one is optimizing our organizational capacity. So this one particularly has to do with like finding expertise in our members and the communities that we're working with, especially in those areas that we've talked about: equity, PSE, advocacy, to help amplify and increase everybody's capacity together within our network. We are recalibrating our work groups and committees, just a tweak. So we're not relaunching, we're not doing anything major, but we are trying to be a little bit more focused in where each work group falls along that spectrum I was telling you about, and making sure the tools and the experience that we're providing for those folks meets that a little bit better. We want to try and use models and tools to find, you know, the sweet spot is how we have it set in here, between one size fits all and custom in support of our members. So as you can imagine, having a big network, we have to do, there are a million things that we could do to meet everybody's needs. I'll say that. So we want to think about balance there. We have a little bit of saying no in here, but that is for the purpose of really focusing on the priorities that we've identified, and then optimizing the best ways for members to help each other, because truly the people in our network are the best resources for other people in our network.
Thanks, Kelly.
Yeah, thank you.
And I guess our last slide is just thank you for listening and being here today. Before we go into questions, I just wanted to encourage you to visit our website, canceroiowa.org. There you can learn more about us, and you can either join our newsletter or make it official and become a member of the consortium. If you want, I did put our emails are in the chat. Otherwise, you can just use our general staff at canceroiowa.org. And don't forget about the Iowa Cancer Plan or the State Health Registry report when applying for grants, or just maybe trying to dream of other opportunities that you can implement for your community. So with that, again, just thank you so much. And does anybody have any questions at all?
If anybody has any questions, feel free to unmute, turn your camera on, and put them in chat, whatever works for all of you.
Rachel and Kelly, thanks so much. I have a quick question that may be kind of silly, but for the sunscreen grants, and I could go on and look at them on my own, but can like individuals do that? Like my pool, my splash pad needs this, or is it like the actual city and that kind of thing?
I was gonna say, that's a really good question. Usually we have asked for like just member or letters of support, or just like some sort of thing that says that you're working with the city and that it's like approved to go in there.
Okay.
If that makes sense. But yeah, an individual could apply.
Okay.
Any other questions from anybody? Nobody wants to go back to that funding slide and like get a little deeper? Like we could go till 1:30 and
I might, Kelly, but I think we can do that offline.
okay, sounds good. I look forward to it.
Awesome. Is there anything else you need from us, Brett?
No, not really. If anybody else has any other questions last minute, make sure you jump in and ask them, or emails are in the chat. You can send them there. Otherwise, thank you very much, Rachel and Kelly. It's been great to hear about some of the ins and outs and the plans of the consortium, who I know we work with on a very regular basis. So it's been great to learn more about that. Thanks to all of you who are here for spending your lunchtime with us. So after this month, we're going to have a brief hiatus. Like I said, we'll be off July and August, but we'll be back in September. I think that'll be on the 16th. We hope you can join us then. And we're still planning some of the schedule for the next season. I think we're scheduled through the fall and into winter, but then we have some of winter and spring left open. So if you or somebody you know has a topic that you think would be worth sharing, you can email us and we can get you on the schedule. But thanks for being here. And just a quick reminder before we go, as a nonprofit organization, IPHA relies on membership dues and sustaining donors to support our mission. So if you're not already a member, we would love it if you'd consider joining. And if there's any students here, you can check with your department chair because some programs have funds to support your membership. But if you are a member already, we thank you. We appreciate any donation that fits within your budget. You can join and give at iowapha.org. If you'd like to see the recording of this or any other Lunch and Learn, those are going to be archived on our YouTube page, Iowa Public Health Association. You'll find any of these or any other webinars that you may have missed or want to revisit. With that, thank you very much. We hope to see you next time. Have a great day, everybody.
Thanks, everyone.